neurosurgeon gets a scan and finds out that there's a brain tumor inside of the brain, the first question they try to figure out is, where is this tumor located? We use terms like intra-axial and extra-axial, and intra-axial refers to a tumor that is located inside of the brain tissue itself. Now, normally there's a covering on top of the brain called the dura. If there's a lesion that is outside of the brain tissue itself, but still underneath the dura, we would refer to that as an extra-axial lesion. Now, a key feature of an extra-axial lesion is that it displaces brain tissue rather than spreading within brain tissue. It will squeeze against the brain tissue itself as opposed to expanding inside of it. And that's a little bit different from how we classify tumors inside of the spinal cord. You see, in the spinal cord, you can refer to a lesion as extradural, intradural, extramedullary, or intramedullary. Extradural would mean that the tumor is located on the outside surface of the covering of the spinal cord. But when you have a tumor that is considered intradural and extramedullary, then that means it's located within the covering of the spinal cord called the dura, but on the outside surface of the spinal cord, not within the spinal cord itself. Intramedullary would be used to describe a lesion that is located inside of the spinal cord, and it will expand within the spinal cord. Consider this similar to an intra-axial lesion. Now, neurosurgeons will use terminology like this to help explain where masses are located to other neurosurgeons, for example, so that it can help identify exactly where the mass is and also what might be the differential for that mass.